Hello and welcome everyone to our series on statistics. Today's presentation is on observational and interventional studies. What are the types of studies? So in this presentation, we will define the types of the studies and we will tell you the difference between association or correlation and causation. So studies are basically divided into two. They can be observational or interventional. In observational, we collect data in a way it doesn't interfere how the data arises, which means that the researcher doesn't interfere with the study subjects. The results that we get from an observational study helps us in establishing correlation. There can be two types of observational studies. The first is retrospective. It means that we retrospectively collect the data from what has already happened, or prospective, which means as the study goes along, we keep on collecting the data. The second type of study is interventional, which means that the researcher directly interferes with the study subjects and randomly assigns them to each groups. This type of study, that is a randomized controlled trial, helps in establishing causation. Let's take an example of an observational study. Here are 6 patients admitted to the ICU. We decide to give them polymyxin and look for acute kidney injury. So 3 patients receive polymyxin, and out of these 3 patients, 2 patients develop acute kidney injury. Now, what did we get in this particular study? What was our conclusion? Does it mean that polymyxin is associated with AKI, or we can say polymyxin causes AKI? I don't think we can say here that polymyxin causes AKI, as we are not sure whether all the patients are equal, which means it was the clinician who decided to start the polymyxin based on his clinical experience. It means that most probably polymyxin was given to patients who were already very sick, and it means they already had a higher risk of developing acute kidney injury. So in this particular study, what we can say is polymyxin is associated with acute kidney injury, which means that most of the patients who received polymyxin had a correlation with the AKI. We cannot causally associate polymyxin with the development of AKI. Now let's take an example of an interventional study. Again, 6 patients admitted to the ICU, we give them polymyxin and look for AKI. But here we randomly assign the patients, with each patient having equal chance of getting selected to the interventional group. So what was the conclusion in this study? In this type of randomized trial where we select patients and randomly divide them into two groups, we can establish causation, as other factors which can affect the study results are thought to be taken care of, which means that the risks of bias have been almost eliminated. Only then we can say that polymyxin is a causative agent for developing acute kidney injury. So previously we thought that correlation is implied by causation. Actually, that's not the case. Correlation is a separate thing, and to establish causation, we need to do randomized controlled trials, because what we forget is there are confounding factors. These confounding factors are mostly present in the observational studies, which make it difficult for us to establish causation. Thank you for your patience, and subscribe to our channel for further information and more such videos on statistics.